Thanks everyone for coming out on your lunch hour to learn about this important topic. And as you see, my name is up here. I go by Mandy unless I'm in trouble, but I put Amanda up here because that's how my email is. So if you call me and I'm in trouble, say, Amanda, I have a question for you. And otherwise, just call me Mandy. So I'm going to tell you sort of a broad overview today about PCORI, and I just want to give a disclaimer, which is that when I got my PCORI funding, it was the first cycle, the first round of sort of the current level of funding that they offer now. And as I've done as best as I could to go back into the PCORI website and really try to make sure that my talk reflects the most up-to-date types of information. But I just want to let you know that my experience was the experience of a few years ago. So I definitely would encourage you, if you're thinking about applying for PCORI funding, to go through and read through a lot of the literature that they have on their website. But I've tried to do that as well. So to my best of my knowledge, this is an up-to-date talk, but I just want to put that disclaimer out there. As Chase mentioned, this is part of a series, and the overarching series for the CRISP seminar series this year is how to successfully obtain patient-centered outcomes research, or PCORI funding. And before I get started into my talk, I wanted to talk to you about what the series components are. So in October, there's going to be a talk on insights from the annual PCORI meeting. So the first PCORI meeting is happening in October, and hopefully several people in this room will be attending that, and we'll be able to share some lessons learned. In November, there'll be an entire talk dedicated to understanding what is patient-centeredness, and I'm going to briefly touch on this today, but this November talk will definitely go into that topic in far more detail. In December, there'll be discussion about the community engagement and pipeline awards, and again, these will be mentioned in my talk, so you'll know kind of what they are, but the nitty-gritty of how and what to do if you want to apply for those will be in December. February will be more of a recap of implementation science methods and how they relate to patient-centered outcomes research. In March, there'll be a presentation about some of the PCORI data networks. The acronym is PCORNet, which is basically a series of several very large data networks that all use a common data model to be able to share data across institutions and wide groups of populations. And then in April, there'll be, I believe, like a panel discussion about lessons learned from successful PCORI grantees. So the learning objectives for today's talk is understanding who is PCORI and why do they exist. We'll go into depth about what their research priorities are, because I think it's really fundamental to understand what these are in order to gauge whether or not your project is appropriate for this institution. I'll briefly touch on the various types of awards that PCORI funds. And then I'd like to spend a bit of time discussing how PCORI awards differ from traditional government grants. And by traditional government grants, I'm really focusing here on NIH grants. And then finally, at the end, I'll give you a little overview about what it means to be patient-centered. But as I mentioned, there's going to be a whole talk dedicated to that very issue. So starting with who and why does PCORI exist? So hopefully you have all been aware of this website, pcori.org. So most of the information that I'm going to present to you in today's talk came directly from the various documents and information that's available on this website. It really is a very comprehensive and I think well laid out website, so I encourage you to spend a fair amount of time looking through all the information on there if you're interested in applying to PCORI for funding. So why was PCORI created? Well, this is a quote. These are quotes directly from their website. And what PCORI has said is that traditional medical research really hasn't been able to answer many of the questions that face patients and their clinicians daily. And even when reliable information does actually exist, it's not always available to patients or to those who care for them in ways that they can understand or use most effectively. And so PCORI was established to help address these specific challenges. So I think this is a really good nutshell of kind of what encompasses PCORI and maybe how the focus of this institution is a little bit different from NIH, the various institutions in the NIH. PCORI operates under 5 core values, and these are values that were vetted through a fairly robust community engagement and public comment process, and also informed by PCORI's advisory board. Obviously, the PC in PCORI stands for patient-centered, so patient-centeredness is one of the main core values. And what this really means is understanding and taking into account not only patient perspectives, but also other stakeholders. So they call it patient-centeredness, but it really is broader than just the patient values and opinions. It's the whole care team that includes the patient, family members, and their caregivers. And that these perspectives and values really guide the work. And we'll talk more about that when we talk about patient-centeredness, what that actually means. The second is usefulness. We all, of course, hope our research is useful, but in PCORI's definition, usefulness really pertains to whether or not the research provides actionable answers, and that these answers are actionable but also important to either patients and or the healthcare community. So it's not important just to answer the question, but to answer it a question that actually has some personal importance to patients and caregivers. The third is transparency. So PCORI really has implemented a number of strategies and frameworks to be able to facilitate public access to the results, which hopefully will help to encourage trust and engagement and participation in between the broader public and researchers. And the idea, I think, here is that eventually this extra engagement and trust will help to promote implementation and dissemination of results. Inclusiveness, so making sure that broad populations are included in, at least in concept. It doesn't mean that your particular study has to include a broad population, but that all populations are taken into consideration when designing a research project, and that there is good justification why you've chosen to remain broad or chosen to hone into a specific population. And PCORI is really interested in providing patient-specific or population-specific evidence tailored to either demographic characteristics, clinical characteristics, and also incorporating patient preferences. And then finally, evidence, using the best scientific evidence to improve the reliability and utility of the results. So how is PCORI funded? Well, PCORI obviously stands for the Patient-Centered Outcomes Research Institute, and the Institute was authorized through funding that was generated as part of the Affordable Care Act. The Institute itself began in 2012 and is currently authorized through 2019. Hopefully the PCORI Institute will last longer than 2019, but I don't have any information, insider or otherwise, about that. But before the Institute was created, there was actually a Patient-Centered Outcomes Research Trust Fund that was created a couple years earlier in preparation for funding the Institute. And this trust fund has two main funding streams that funnel into it. The first is about $150 million annually that's coming from the general fund of the the United States Treasury. And then the second is a $2 per person fee for those that are enrolled in Medicare, private insurance, and self-insurance plans, which brings in about $170 million annually into the PCORI General Fund. People ask me, and I asked PCORI when I first got my grant, is this a governmental agency? Because that has implications in terms of reporting and how you assign manuscripts and various other things. And the short answer is no. It's actually considered an independent, nonprofit, non-governmental organization. I think it's really important to acknowledge this, because what it means is that if you are trying to shop around a grant idea, you're not breaking any rules if you decide to apply to PCORI and simultaneously apply to NIH. Obviously, if you were so lucky to get both grants, you would have to give one of them back, but you know, that's unlikely to happen for most of us, so sometimes it can make things run a little bit faster if you try to shop around in multiple places at once. So you can apply to government agencies and PCORI simultaneously. Any questions about sort of the overview of PCORI before we go into the research priorities? Okay, right. All right, so I know that you probably can't read this. I just want to put this up here because it comes directly from the research agenda, National Priorities and Research Agenda PDF, which I've put the link here on the bottom. And Chase mentioned that these slides will be posted on the CRISP website, so you'll be able to go in here and follow these links. But I want you to be able to recognize this figure because it's a key figure in this document, and one that we're going to go through in some detail. So to orient you here, this is basically the framework for the national agenda of PCORI's research. On the left here, you have 5 priority areas, and we'll talk about what those are. In the middle are PCORI criteria. So these are the criteria with which applications are reviewed and evaluated under. And all of the PCORI criteria map to various priorities. Not every criteria applies to every single priority area, but there is a lot. So each priority area has several criteria that map to it, and all of the criteria areas are eventually used up if you go across the 5 priorities. So the priority areas and the criteria were used by PCORI to set a research agenda, and that will become more clear when we talk about the types of funding opportunities. And from this research agenda, there are different funding announcements. Some are very broad, sort of akin to a parent NIH R01 application, and some are very disease or population or methodologically specific. So we'll talk more about that later. So let's first focus on the 5 priority areas. The first one is the assessment of prevention, diagnosis, and treatment options. And the way PCORI describes this is comparing the effectiveness and safety of different prevention, diagnosis, and treatment options to determine the ones which work best for different people. So this is, again, getting back to that concept that PCORI likes to consider different types of populations based on various types of either clinical or personal characteristics, recognizing that the same prevention, diagnosis, or treatment option might not be the same for every population. The second priority area is improving healthcare systems, and so this is really research that's focused on comparative effectiveness at the health system level in terms of how to improve access to care, supporting patient care, innovative use of health information technology, coordinating complex care, and also extends to workforce solutions, deploying workforce and making sure that there's adequate supply of different types of workforce for the clinical question at hand. The third is communication and dissemination research, which is really focused on comparative effectiveness of approaches to providing comparative effectiveness research information to various groups of people, empowering people to ask questions about the research, to use the information, and also to support shared decision-making, particularly for preference-sensitive conditions where there is no clear cut winner in terms of the right choice of treatment outcomes. Addressing disparities is the fourth area, and this is looking at identification of potential differences in the prevention, the diagnosis, the treatment, or the preferred outcomes across populations and the healthcare required to mitigate these disparities. So one thing I want to point out here is that, again, looking at these terms, preferred outcomes, it may be that there's the same clinical outcome that's desired by various populations, but what's preferred from the patient perception may be very different depending on the population. And so there can be disparities framed around that idea. And then the final one, and this one was actually not a priority area when I applied for my PCORI award, but came online later, was just accelerating methods related to patient-centered outcomes research. And so this is really about building an infrastructure and training researchers and other stakeholders, as well as validating and designing new methods for conducting this type of work. So these are, I put here the 5 priority areas again and talked about some specific interests that PCORI has listed. This is definitely not a comprehensive list. So if you don't see your area of interest on here, it doesn't mean that PCORI is not an appropriate entity for you, but I just wanted to give you a sort of a sense of the types of research questions or interests that PCORI may have related to each of these priority areas. So in the assess prevention, diagnosis, and treatment options, this can be studies of diseases that are either really rare and hard to study through a typical NIH framework, or are maybe not that rare but are inadequately studied. Comparisons where knowledge maybe could address individual differences in patient values and preferences, or things like using decision aids and risk stratification tools, comparing that to usual approaches of care. In the improving healthcare systems priority, some examples are comparing alternative system-level approaches to supporting access to care. So for example, the use of patient navigators or care coordination. And another area of interest is how different approaches may affect patients and their caregivers. And caregivers can mean anything to PCORI, from the doctors providing care to family members to insurance payers. In the communication and dissemination area, some of the examples are comparing alternative communication and health literacy strategies. So this might be the use of incorporating social media or addressing various levels of health literacy through different communication modalities. And then using things like the electronic medical record to help in clinical decision making. And then in the addressing disparities, this could be something like comparing interventions that might reduce disparities in a particular disease outcome, or comparing strategies about how barriers may be differentially affecting various populations. And then in the methods, identifying optimal methods for engaging patients is one of several examples that PCORI provides. In terms of the priority areas and how PCORI funding is distributed, you can see that most of the funding goes for the first priority area, the comparative assessment of options for prevention, diagnosis, and treatment. And the least funded are the communication and dissemination research and addressing disparities. And I'll show you later on a little bit of an insight or a snapshot into how many applications tend to go to each of these groups so that you can kind of assess what's the likelihood of getting funded if you pick one section versus another, knowing that the number of applications does not always completely match the percent of funding allocated to that particular priority area. And this information I actually got back from 2013. I couldn't find any more updated information, but as far as I know, this is the current level of allocation for PCORI funding right now. Okay, so now let's talk about the research criteria, or PCORI criteria. It doesn't actually just apply to research, it can also apply to their programmatic funding. So these PCORI criteria were a little bit hard for me to wrap my head around as I was putting this together, but as I've gone through this type of talk a couple times now, it's becoming more clear. And I think the best advice I can give you about how to think about these criteria is to really read through the RFA for whatever application that you think you might be applying for really specifically, and try to highlight within that RFA these various criteria. They're usually described kind of descriptively in the RFA itself, and try to pull those out in your application and reference them specifically so that it's obvious to the reviewer that in your application you are addressing specific PCORI criteria that were mentioned in the RFA. But let's go through them a little bit more detail. So as I mentioned, each criteria item maps to one or more funding priority areas, and the announcements that PCORI makes are developed using these criteria in mind. And they're also really critical in the review process. So when I got my pink sheets back from my PCORI review, it actually said like criteria 1, how did you do on this one? Criteria 2, how did you do on this one? So they take these criteria really seriously. So that's why I like to spend a few slides on this. And again, there's a lot more information about how these criteria are assessed, used, and what they mean in this National Priorities and Research Agenda PDF, which I have the link for down below. Okay, so these are related questions. This is not a full list of questions, but just to give you some idea of what these criteria mean to PCORI. So in terms of how your research might impact the health of individuals and populations, PCORI is interested in having you tell them how many people are affected, how severe are the consequences, and what are they. And remember, this PCORI funds not only rare diseases, not only common diseases, but also rare diseases. So you don't have to have a disease that affects a lot of people, but you do have to explain the implications of the clinical question that you're talking about. Probability to improve research. So how likely is the information that you might gain from your study to enable people to make important improvements in health, in the quality of care, or in public health more broadly? Inclusiveness of different patient populations. So as I mentioned, you don't have to include everybody, but if you decide to include only a small subgroup of people, you have to justify why that is. And PCORI particularly likes studies that focus on populations that tend to be understudied. I'll talk more about that later. But the general core question is, would the new information be likely to increase understanding of differences in either best practices or strategies based on each individual's unique characteristics? And these could be biological, psychosocial, or demographic. Addressing knowledge gaps. So does the medical care in a particular area show a lot of variation in practice, which would suggest that the best options aren't really known? Or alternatively, maybe the best practices are known, but there's not a lot of knowledge from the clinician or the patient side that the various options exist. And so the real gap in knowledge is the dissemination of evidence-based information. Impact on healthcare system performance. So will the information gained from your study help improve treatment or outcomes? And particularly, how does that improvement relate to the amount of money invested? If you have a really great thing that costs a huge amount of money, it's not going to be that feasible or generalizable to be implemented. Potential to influence decision making. So will the information be more likely to help patients and or clinicians address decisions that are currently difficult to make? So these are often those preference sensitive conditions where there's no clear cut best solution. Patient-centeredness, of course. Have patients or other key stakeholders really explicitly identified the need for research in this area, or maybe there's a lack of resources in this priority area. And this is really, I think, key. I wish I could highlight this one in even bigger font, but we'll talk more about patient-centeredness later, but I think this is something that people tend to gloss over, and I think this is really one of the most important criteria that PCORI expects to see. Obviously, rigorous research methods. So does the research use or develop methods to addressing patient-centered evidence? And then finally, efficient use of resources. So PCORI is particularly interested in studies that will generate products that can be used by other people wishing to address the same clinical or patient-centered outcomes question. So when PCORI describes who and what we fund, basically their research focus has two main arms. One is comparative clinical effectiveness research. So all of those priorities that I mentioned earlier, you could think about in the framework of comparative effectiveness. And then as a sort of tangential but related entity, the methods and infrastructure related to comparative effectiveness research. Under conditions study, they are interested in studies about conditions that affect large number of people across populations, perhaps differently depending on the population in consideration, or conditions with a heavy personal or societal burden. So for example, something like children with special health care needs, which might not be that common, but has quite a significant social and personal burden, or rare diseases that are difficult to study. So really the whole gamut in terms of the conditions studied. In terms of the populations that PCORI is particularly interested in, these tend to be the populations that are understudied. So racial and ethnic minorities, those who are older, those who are low income, women and children, lesbian, gay, bi, and trans populations, individuals with special health care needs, and this is defined by PCORI not only as people with disabilities, but also people who may have chronic diseases, rare diseases, and or genetic diseases. People of varying levels of health literacy, which can include those with limited English proficiency, and then finally veterans and their families. And as you can see, it's very possible in many types of research studies to include several of these groups all together. So it's just important to know what these priority groups are so that you can kind of call them out explicitly in your application to PCORI. All right, any questions about the research priorities before we move on to our next topic, which is the types of PCORI awards? Nope, crickets, okay. So PCORI has two different types of research, two different types of funding. There's research funding and then there's programmatic funding. So I've divided up the slides in that way. In the research funding, the main kind of core part of PCORI funding is research priority area specific awards. So these relate to the 5 priority areas that we talked about initially. They were on the left-hand column of that sort of, I don't know, bottle-shaped diagram. And these awards occur in cycles that happen 3 times a year. They're typically $500,000 per year in direct costs and lasts a total of 3 years. And so this is kind of like the standard recurring thing that happens every 4 months. They also have a variety of disease-specific requests for applications, and these have a lot more variability in terms of the length of time and the amount of funding. So I've seen in the past funding up to 5 years, funding up to $4 million per year, which is obviously a lot more than $500,000 per year. These are some specific examples listed here of past disease-specific RFAs, so one about obesity treatment in underserved populations, effectiveness of transitional care, and something that they called large pragmatic trials to evaluate patient-centered outcomes. So it's important to know that there are these 2 areas because PCORI updates their website fairly regularly. You can actually look into what the future funding is in about 3 to 6 months time window ahead of time. So you have to decide if there's a specific RFA, does it make more sense for you to apply under that mechanism versus the recurring priority area research awards, which will happen systematically over time. In terms of the current and future opportunities that don't really fall into either of those, or maybe you could say that they are more in the disease-specific RFA category, Right now, there's a call for patient-powered research networks demonstration projects. So PCORI in the past has funded a bunch of patient-powered research networks, which are essentially patient or patient representative group-driven disease-specific research networks. And so those were already funded, and now PCORI is asking for demonstration projects related to those. The second is a very specific RFA about management strategies for treatment-resistant depression. There's also one out there right now for new oral anticoagulants in the extended treatment of venous thromboembolic disease. And then another call for pragmatic studies to evaluate patient-centered outcomes. And then finally, there's an upcoming RFA about the PCORI networks, which are the data networks that have already been established through PCORI funding, some health systems demonstration projects related to those. Okay, turning our attention now to the programmatic funding mechanisms. So these are not research projects, these are more program development. The biggest one is the Eugene Washington Engagement Awards. And these awards are really meant to build meaningful communities of stakeholders and to allow them to be able to better participate in the research process, all the way from designing the study to participating in the study to dissemination of the results. And the goal of these projects really is to develop tools and resources for others to use who want to develop community engaged research processes. And Sean O'Leary is here. He recently got one of these. I don't know a huge amount about these, so if there are questions about that, I would point you to him. I was going to point you to him even if he wasn't here, so I'm glad he's here so he knows that I'm doing it. The second are the pipeline to proposal awards, and so these are tiered awards. There's tiers 1 through 3. Tier 1 is a 9-month award for a maximum of $15,000. Tiers 2 and 3 are $50,000 over a period of 12 months. And the goal of these awards is really to develop communities in which community relationships in which you want to eventually do patient-centered outcomes research in. So PCORI recognized pretty early on that it's hard to do patient-centered outcomes research if you don't have your community of engaged people already available to you. So these pipeline to proposal awards are small awards that are meant to help you really draw together your stakeholders to start forming relationships so that you can then come up with a research question and study design. Within the Eugene Washington Awards, there are 2 subtypes. There's a knowledge training and development and dissemination award category, which is $250,000 of direct costs over a 2-year total time period. And then there are smaller awards, which are research meeting and conference support. And these can either be applied for as one-time awards with a maximum of $50,000 or multi-year awards where you're going to do training or research meetings in a more ongoing fashion for a total of $250,000. And I believe that's a 5-year time frame for that. Questions about that before we move on? Sure, question in the back.
Yeah, just going back to your previous slide, it was my understanding, and it makes a big difference, on the engagement award, the first one, the 2 years, the $250K is total direct and indirect.
Oh.
With a 40% indirect cost rate.
Is that what you?
I think that's correct.
Okay, so I guess that was a misunderstanding on my part. Yeah. So that does make a huge difference.
Huge difference.
Yeah. Thanks for the clarification.
Is it know how many of the recurrent grants they give per cycle?
There's a ceiling, so they tell you the total amount of money that will be awarded. And so for the ones that are a fixed amount, like the $500,000, you can just do the division. Like it'll say a total of $18 million, and you're like, all right, each one is a $1.5 million grant. So you can kind of figure it out there. So I don't have the numbers off the top of my hand, but they relate to that distribution of the 40%, the 20%, and the 10% among the 5 priority areas. And then some of the disease-specific awards, there's only 1 award granted, so they're really different. Other questions? Okay. All right, so let's focus now on how PCORI awards differ from traditional government grants. So PCORI differs from NIH funding in particular in the following ways. The first thing to know is that PCORI awards contracts, not grants. So this has a lot of implications, not one of which is that you actually have the same speed type for the entire year, for the, excuse me, for the entire project period. So if you have a 3-year project, you get one speed type at the beginning. It lasts the whole time period, which means that it's a lot easier to kind of move funds from one year to another because you don't have to do a no-cost extension or carry forward or anything like that. So that's a very concrete example of why contracts are really different from grants. The biggest one, however, is that contracts are milestones and deliverables driven. So PCORI gives you money in increments, depending on whether or not you can demonstrate that you've met milestones and deliverables promised that you outlined during the application process. And there's a little bit of negotiation if your grant is, or your project is to get funded, to make sure that the milestones and deliverables are in alignment with what you think you can actually do, because sometimes there's changes in the situation between when you apply and when you actually start to do the project. But the key thing is that you don't get more money until you show that you have done your milestones or provided a really good justification about why the milestones were not met. And this means that your payment is really tied to specifically to successful performance, which means in reality that you have to do fairly frequent progress reports because PCORI wants to have ongoing engagement with you, understanding where you are in the process. It also means that there is essentially limited or in many cases no opportunity for a no-cost extension. So this is really different from a typical NIH grant where sometimes you can think about getting an extra 6 months out of your project, but in PCORI, the end of your contract is the end of your project and the money goes away after that time. So to reiterate, PCORI grants are not like other grants. In fact, I should say PCORI projects because they're not even a grant. Okay, so let's drill down a little bit and talk about the application process. So in an NIH application, I've listed the typical parts of the application that are required. Most of these, I'm sure, are really familiar to you. And there are a lot of different parts in a PCORI application. So I've highlighted in bold and underlined the parts that are different that aren't really included in an NIH application. A letter of intent is required for almost all of the PCORI applications, and we'll talk a little bit more about the significance of that. But the main thing to know is that these letters of intent now are competitive, so they're used as a vetting process to see if you're going to be invited to put in the full application. This wasn't the situation when PCORI first began, but it is now. Within the biosketches category, there is still a 5-page biosketch for each key personnel, but PCORI wants to also see biosketches for other key stakeholders. So this might be a community member that you have on a board who obviously doesn't have an NIH-ready biosketch because they're a lawyer or whatever, do something else. So that PCORI has their own template that they want these other stakeholders to use. There's a technical abstract and a public abstract. So the technical abstract is fairly similar to what an NIH abstract would be like, but the public abstract is meant to be in lay terms and is published on the PCORI's website. So just bear that in mind. Milestones, as I mentioned, are something that you have to delineate very clearly as part of the application process, and there's a separate milestones document that goes in with the application. The research strategy has additional components, and I didn't list them here, but we'll go through these on the next page. So there are 3 here that are very similar to what is in an NIH grant, and then there are a couple more, but I'm going to talk about those on the next slide. There's also a whole separate section that's required. These are for now the main PCORI grants for the Eugene Washington and the programmatic awards. Not all of these necessarily apply. So for the most part now I'm talking about these revolving priority area specific grants. There's a whole section on dissemination and implementation potential and a whole separate section on the replication and reproducibility of research and about data sharing. Then there's like an NIH application, there's human subjects, performance sites, which is like your facilities document, an optional appendix, and then of course letters of support. And I would encourage you to include letters of support from patients or from stakeholders directly as part of your letters of support section of a PCORI grant. Okay, so drilling down now more into the research strategy components. So in an NIH research strategy for an R01, you get 12 pages. And NIH that asks that you talk about 3 things, which is the significance of your proposal, its innovation, and your approach, which is like the methods. And usually people include a timeline in their approach. In a PCORI application, you get 20 pages, but you can see that you have extra things that you have to put in there. So in addition to background and significance and design or approach, you have to include milestones and a timeline section. You have to include a section about patient population, and this needs to include specific plan for how you're going to recruit people, as well as race and ethnicity tables. You need a specific section about your research team and environment. And then really importantly, you need a research stakeholder engagement plan as well. So here is how the page limits of PCORI grants kind of break out. So I mentioned that you have 20 pages for the research strategy, which includes these 4 extra components. You get 2 pages for the dissemination and implementation plan, 2 pages for reproducibility and transparency of results. Human subjects is now limited to 5 pages. I believe in NIH grants they're unlimited. Your appendix is limited to 10 pages, and then letters of support are unlimited. So I mentioned earlier competitive letters of intent to apply. So to orient you to the slide here, these 5 sections on the bottom correspond to the 5 priority areas. So this is assessment, prevention, diagnosis, and treatment options. This is improving healthcare systems. This is disparities. This is communication and dissemination research. And thank God for those methodologists. They've got a really good chance of being asked to apply, because you can see that their applications invited us far higher than those of the other priority areas. So just to point out here, this is the priority area where 40% of the funding goes to, and you can see that they get the most applications, but only about 1/3 of them get asked to have their application fully submitted. And then some of these other groups down here, so for example, disparities, only 10% of the funding goes to this, and the ratio is about the same, but the absolute numbers is, I think if you look at it in terms of the proportion of funding, it's actually higher. Questions about that before we move on? Yeah.
How do these relate to the, like the engagement awards? These are for this is the big research award.
Yes, I don't have information on the engagement awards. This is for basically the RO1 equivalent. Yeah. And I also wasn't able to find information on, like, once you get invited to submit your application, what's the likelihood that you'll actually be funded? That seems to be a secret that PCORI is keeping pretty close at hand, so I don't have information about that. All right, so for the last few minutes before we get into a more unstructured Q&A section, I'm going to just turn our attention to what it means to be patient-centered. So here's what PCORI says about this, that patient-centeredness really refers to the level of engagement in the research process, and they define it as meaningful involvement of patients, caregivers, clinicians, or other stakeholders throughout the research process, from topic selection through the design and the conduction of the research all the way to dissemination of results. So they really like to see, if possible, engagement all the way from the study idea through to the end, where you're talking about how great your research study was. And that's really hard to do. It's definitely a different model than what we've typically used in research, which is why they have these engagement awards, to allow you to develop the needed infrastructure to be able to do this full spectrum of engagement all the way from generating the research idea through to the end. So in terms of stakeholders, PCORI defines them pretty broadly. They can be patients that represent the population being studied, their family members, their caregivers, which could be clinicians or could be like home-based nursing care, or their physical therapist or their psychiatrist or whoever. Organizations that represent these patients, so maybe like the Crohn's and Colitis Foundation is a stakeholder. And they also say members of constituencies based on professional rather than personal experience. So this could be things like health insurers, health systems, policymakers, and clinicians. So it's a really broad way to define stakeholders. So patient-centeredness really weighs heavily in how the PCORI research agenda was designed. And these are some direct quotes. This is definitely not comprehensive, but just to give you a sense of how much PCORI thinks patient engagement or patient-centeredness needs to be really at the forefront of the research process. They talk about wanting to have patients promote patients and their caregivers as real partners, having very explicit roles all the way through the design of the study to dissemination, including things like governance of how the study is being implemented. Seeking to understand core questions from the express perspective of the patients and the caregivers. So What this means to many researchers is that the question that you might find most interesting is not the question that patients themselves might find most interesting, so you need to figure out how to navigate that potential discrepancy. Again, focusing on outcomes that are important to patients and their caregivers and are also useful in making healthcare decisions. Emphasizing transparent science that involves participants in decisions about making data available for further study. So that's not something you've seen every day, I don't think. Emphasizing knowledge that's likely to make positive differences in the lives of patients. So again, this gets to what's important to the patient, not necessarily what's important to you as a clinician or a researcher. Funding efforts to produce tools that assist patients and healthcare professionals, emphasizing ideas that emerge from the community of patients, clinicians, and research, and seeking to listen and learn from the wisdom of those whose lives are lived and affected by these conditions. And then measuring the success by the impact on patient outcomes. So that last one I think is so key. You want to make sure you incorporate into your research study not just clinical outcomes, but outcomes that you can demonstrate are measurably important to patients. And that may also be clinical outcomes, but it may also include a lot of other things such as their quality of life or their functionality. So there are a lot of tools out there to help you understand better what PCORI means by engagement. The first is the methodology standards, and I've included the link there. This actually was not available when I applied for mine, but is available now, and it talks about the requirements that PCORI feels need to be demonstrated in terms of engagement and patient-centeredness. PCORI also has an engagement program, which is more like an online and not online educational program. So they host a variety of events, including workshops, both in-person and webinars, as well as written materials and slide decks and things that talk about how patient engagement can actually be done. They also make available successful engagement plans from funded projects, and that's listed in the document here. They also have available a compensation framework. So this relates to compensation of your stakeholders. Sometimes it can be difficult. It was clear in the first round that nobody had a really good idea of how much they should pay a community member for their service and what kind of service warranted what kind of payment and what kind of payment should be offered. Should it be money? Should it be a gift card? Should it be one time? Should it be ongoing? So this is part of what's discussed in this now available compensation framework. And then they have something called the engagement rubric, which we're going to dive into just a little bit more. But in a nutshell, what PCORI means by patient and stakeholder involvement is that ideally the patients and stakeholders help bring up the research question, design it, design the research tools, oversee the implementation of the project, interpret the results, and disseminate them, which means that you have to write your stakeholders and patients into the budget, ideally get them involved in the thinking stage of your project, and have a clear plan that you write out and delineate to PCORI of how they're going to stay involved throughout the research process. So here's a couple of examples from the engagement rubric, which includes 4 sections: planning the study, implementing, dissemination, and I'm blanking what the 4th one is, but it's sort of the broad trajectory of a typical study. So in planning the study, some of the things that PCORI suggests that you can do to help enhance engagement is to allow stakeholders and patients to identify the topic and the specific research question. So if any of you are familiar with boot camp translation, this is a really good example of how this happens. You go to a community and you say, what are the most pressing health issues in your community? And they say heart disease, alcoholism, diabetes. And you say, okay, let's talk about diabetes. What do you want to research on this? I mean, it's a really different way of doing research. And not every research study is able to go to that level of patient engagement, but certainly I think PCORI would welcome even those really groundswell of topic areas. Helping to define characteristics of the study population. So are you going to take older diabetics, younger diabetics, type 1, type 2, what makes the most sense? And then designing the study so as to minimize patient disruption. So how exactly might you do this? So one thing that PCORI suggests is you can describe in your application any meetings or events that may have already been held to engage stakeholders in the design and planning of the study. So for example, someone who had a pipeline to proposal award could talk about what they did during that. But even if you don't have that type of award, you can still potentially pull off some focus groups or some online discussions trying to get some of this information into your application. Another option would be to provide letters of support where stakeholders really describe in detail how they were involved in developing the research topic, the study question, the design, etc. So in the rubric, they also talk about conducting the study. So you can involve stakeholders in drafting or revising study materials or protocols. They can actually be involved in the recruitment of study participants, helping with data analysis, evaluating patient and stakeholder engagement, or maybe serving as a person on a safety monitoring board if you're doing some kind of intervention study. And so in your application, some suggestions from PCORI are clearly articulating the roles, the specific roles that various stakeholders will have in each phase of the study, or even describing plans to kind of check in at a regular interval to make sure that the stakeholders are able to evaluate and convey to you how much they perceive that whether or not they're meaningfully involved in the work. So in my grant, when I wrote my grant, here are some things that I did. I got some direct quotes from potential stakeholders and wrote them into the grant to try to show that the question that I was studying was coming from the community and of importance. I had some members that eventually formed our community advisory board write letters for the grant, and these were community members, just people that weren't involved in healthcare in any way. And then I set up collaborations with a variety of community groups and got letters from them that were within the population that I was interested in studying. In terms of actually implementing my project, I actually developed a little contract. It's obviously not legally binding, but it sort of really outlines what I had hoped that the community members would do as part of my project, and they agreed to at least try to do those things over a specific time period. I held our meetings in their space, so they selected where is a good place for them to meet. I paid them really well, and I actually gave them a bonus for full participation. So we had a series of meetings over the project, and they got extra if they attended all of the prior meetings. I tried to really emphasize at each meeting how important their input was in the project and showed them in a feedback way, like, last time we talked about this, and because of that, I've now changed things, and this is the new plan. What do you think of this new plan? I've had them come to research meetings where they presented the work. So these are not research people, but we worked through how they present a poster, and they were able to see what we do at national research meetings. We had some celebrations of successes. So I gave them all coffee mugs with our project logo on them, and we had a little party with food. And of course, once publications start to come out, I'll be recognizing them by name on the publications and any presentations that we've done already. So putting it all together, if I want you to take away one thing from this talk, it's this, which is PCORI is not NIH. So you have to really think through the PCORI application process and whether or not that institute is the right one for you. You have to think about it carefully and read through the information on the PCORI website that's really specific to that agency, because there are a lot of different criteria that aren't necessarily applicable to NIH funding. And that is all I have for us today. So I'm happy to take any additional questions if anybody has anything. If you'd like to contact me, you can use my in trouble name at ucdenver.edu.